Hi everybody. Today there's a total of 161 active cases in the Greater Shepparton local government area. In the last 24-hour reporting period there's been 21 new active cases. Of those, 12 are linked, 2 are not, and 7 remain under investigation. And we have 9 patients admitted at GV Health at the moment. 2 of those are in intensive care and one's on a ventilator. The other patients are just in the respiratory ward. In regards to transmission, we're now over 85 households where there's active cases in Greater Shepparton. What we are still seeing is that same trend of transmission effectively all being in terms of household to household movement. So, of course, we're encouraging people not to move between households. There's only a very limited number of reasons why you should be moving between households, and they're only for caregiving or intimate partner reasons, and we're seeing that that doesn't appear to be the case in terms of how the transmission's occurring in households. The other thing, in addition to calling out to individual people not to do that, that's in regards to moving between households, is that through your family or friend networks, or if you do become aware that people are moving between households, what I'd encourage you to do is just to have a quiet conversation with those people who you may be aware of that are doing that, in order to encourage them to stop moving between households, particularly where there is high risk that's known. Many people are sharing information these days about having been in contact with COVID positive people, or the fact that they might have COVID-19 themselves. So that information is being shared around the community, and we're certainly encouraging, I am encouraging any people who are aware of that and people that are moving between households to please encourage your family and friend network groups to stop doing that, because that is actually where a lot of the problem is for us at the moment. As I mentioned before, to have 161 active cases now in Shepparton and 21 new in the last 24 hours, and a number already so far today that we'll talk about tomorrow or on Friday, it is the main way that transmission is occurring. So we're calling on people to please stop moving between households unless you have a reason to do so. So I'll take questions now on that, then we can chat about vaccination if that's okay.
Have you heard any indications of a lockdown, I guess, in both of these new cases?
No information that I'm aware of in relation to lockdown. Again, I think the lockdowns are one measure in terms of trying to limit the spread around the community, but in this case we know that primarily the transmission is between households, and that's why we're asking people to refrain from doing that, and also friends and family members, encourage your family members and friends that you may be aware of that are moving between households to stop doing it.
How frustrating is it, considering the message has been pretty consistent since grand final day to stop heading to other people's households? You said it's still happening.
Yeah.
How frustrating is that?
It is. It's frustrating. There's no doubt about that, because not only does it increase the risk of other people in the community picking up COVID, through inadvertent contact or some other means, it increases that risk that's the case. But also, what it's doing is placing pressure on our hospital services, and we are at the moment, we have a number of patients who are requiring admission that aren't COVID positive, that are requiring admission for other medical reasons, and having an increased number of people requiring admission for COVID-related services certainly places more pressure on us operationally in a day-to-day sense, and across all of our other services as well. So we're redeploying people from different community-based or ambulatory services to help with contact tracing and testing and efforts such as that. But ultimately, the only way we're doing that is temporarily closing services to free up the staff to dedicate to the COVID effort, and that means people who would be receiving other services normally have had to wait, or will have to wait for a little bit longer than what they ordinarily would, and I'm sorry that that's the case, but that's really the circumstances that we are faced with at the moment.
How much of an impact is that having? Is dozens of cancellations of other services, or how many people is this affecting?
Yeah, I don't have the exact number of people it would be affecting, but as an example, we're really down to a very small number of appointments in our specialist consulting clinics. Our dental services, for example, have been scaled right back. A number of our community health services as well have been really scaled right back, just so that we can redeploy people into these other more essential services just at this time.
And what happens if that number keeps rising and we see more cases in Shepparton and inevitably an increase in hospitalisations as well? How much further can the system stretch before you need assistance from
Yeah,
other
we can keep stretching, but I guess and we'll continue to do so to do what we have to do to provide the services. And I just want to thank and acknowledge all of GV Health staff, because they're doing a terrific job under very challenging circumstances at times, and many of our staff are working extra hours, double shifts, more than that they're contracted to work for, so they're really going above and beyond, which is fantastic and greatly appreciated. But I think on the back of really quite a challenging 18 months or almost 2 years now in this COVID environment, people are getting pretty tired, and we need to be mindful of that. We're certainly mindful of that as a health service and as an employer. But in terms of the support that we were able to receive from other health services in August and September, but the comment and my observation is that a lot of the health services in Melbourne and other regional centres in Victoria, where we were fortunate enough to have other staff come and work with us, are equally as stretched as we are, particularly in the metropolitan areas of Melbourne as well. There's a lot of demand for hospital-based services in the metro areas at the moment. So some of that capacity is not as great as it used to be, just because there's a lot more COVID demand in the system in general.
We've seen schools go back this week for a limited number of students and had the 2 exposure sites or a couple of exposure sites pop up.
Yep.
Are you worried that we might get more of that and lead to probably not a repeat of August, where we had 20,000 in isolation, but are you worried about that happening again?
Yeah, there's always the risk, as at any time with just general opening up, that there would be higher rates of transmission, and that's a known risk, and it's been worked through in terms of aligning with when we get greater rates of vaccination coverage. So I agree that I think it's unlikely we would end up with the number of people in isolation and the impact on not only GV Health but all the employers and businesses in the Shepparton and Maroopna area, and we wouldn't want to see that again. I don't think we'll get to that situation, but I guess, as I referred to before, people are already pretty stretched, not only in health services but in many other sectors and industries, and we just don't want to place people under that amount of pressure any longer than we absolutely have to.
We're hearing about new COVID cases in Strathbogie. Is this of concern at all?
So there's, in the Strathbogie local government area, there is a case that involves a school, St John's Catholic Primary School. In fact, there's a meeting occurring right now in relation to our public health unit working through some issues with not only the school but other local health services in that area to support them and provide advice at this stage. So I guess, going back to what Max said a minute ago, we're probably going to see these sorts of things occur as schools open up and there's more movement of people around, and particularly in those areas where people are in close proximity. Yeah.
How many cases are linked to that school?
There's only one at this stage, one student, but there's further testing that's happening at the moment. And of course, anyone right across the whole state, or country for that matter, who has any symptoms of COVID-19, they should get tested straight away and don't delay getting tested as soon as those symptoms start.
We've seen that the Invergordon campus is a Tier 1 site. Can you tell me a bit more about what's happened there?
I'm not across that level of detail, sorry, but it would be similar circumstances in terms of what I just described, where someone's been to a location and they've been listed as a high-risk site. And again, it's a bit like where you've got high numbers of people moving through condensed or tight areas, they're the more higher risk areas that are going to be posted as exposure sites going forward.
Are we expecting more cases over the next couple of days to stay at the same level they are now? Or I know earlier in the week you said you'd hope they would decrease. Do we think they're still going to decrease?
So I think on Monday I said I was optimistic that the case numbers might fall back to the lower teens or even into single figures based on 21 cases in the last 24 hours and you know, somewhere around about half of that number already today. I think it's unlikely that we'll start to see those numbers trail off in the next few days. So we just have to allow the contact tracing teams, and they are getting through the work as quickly as they can and interviewing and talking with people about how they've perhaps been exposed to COVID and then trying to do that detective work. But I think it's in the next few days, it's probably more likely than not that we'll see those numbers in the teens continue. Okay. All right, good. In relation to vaccination, so maybe some more positive news. In relation to vaccination, people might be aware now that in the Greater Shepparton local government area, there's 92.8% of people that have had a first dose now, and 61% have had a second dose. So that's a really big improvement, even in the last week since those numbers have been published and collated. In terms of the Get the Jab Done campaign, last week when we launched the campaign, we knew there was 5,000 people that we were targeting to come forward to make an appointment for first dose, and then of course that would flow to second dose. Since we launched the campaign last week, and based on those numbers just for the Greater Shepparton local government area, we've seen a total, that number's now down to 3,247, which is terrific, and that's 1,753 people who have come forward and had their first dose, which is terrific, and we want to encourage people to do more of that. So I guess I'd like to extend and pass on my thanks to those 1,750 odd people that have come forward and got their first dose done. We look forward to you coming back in the not too distant future for your second dose, and of course that can be at the GV Health facilities or GP clinics or pharmacies as well. So really thanks to the community and everyone involved for getting behind the Get the Jab Done campaign, and as I've said before, it really is the easiest and simplest thing we can all do individually and collectively is to get those vaccination rates up to more than 95%, if not higher, in the coming few days. So for those 3,250 odd people who haven't made their appointment, or anyone right across the state who hasn't been vaccinated yet or made an appointment to be vaccinated, we encourage you to do that and just simply get the jab done, because it's the best way to reduce your chance of getting COVID and then end up, if you do contract COVID, we know that over 80% of people who have been in hospital recently with COVID are unvaccinated, and over 90% of people in ICU have been unvaccinated as well. At our Macintosh Centre, we do have now access to the Moderna vaccine. So anyone, that's for people aged over 12 years, and it includes people aged over 60 as well. So anyone who we're taking any walk-up, no need to make an appointment, so walk-in appointments for the Moderna vaccine and for AstraZeneca for people aged over 60. Anyone who needs a Pfizer vaccine or who is after a Pfizer vaccine will still need to make an appointment, and that can be done on the Department of Health website, coronavirus.vic.gov.au. So please, if you haven't made your appointments for vaccination, please just do so and get the jab done. We talked about, I think last week, that we'd commissioned another bus in our partnership with the Dysons Group. That bus we expect will be on the road from Monday next week. So that's really an important initiative for us. We know Jabber the Bus has been really successful, and we're looking to extend that, of course, with the second bus and take the vaccination to areas not only in the Shepparton and Mooroopna townships, but broader than that across our area for the local public health unit's vaccination campaign. And finally, in terms of the second bus, we do have a competition, so thanks, I think we've received probably hundreds, would it be? Hundreds of nominations for the name of the second bus. In the next one day or so, 24 hours or so, we're preparing a short list of those names, and we'll share that on the GV Health Facebook page and then ask the community to vote for what will be ultimately the second name for the vaccination bus. So I might hand over to Councillor Kim O'Keefe now, who's the Mayor of the City of Greater Shepparton, and ask him to say a few words as well.
So good afternoon everybody. I'd like to start by actually acknowledging the amazing work. Matt's pointed out today, GB Health staff, Matt in particular, it's been an incredibly challenging time and they have been extraordinary, as has the vaccination centre, the testing sites, and all essential workers, the community. We're trying to do what we need to do, but I must acknowledge the incredible step up with vaccinations. We're really, really proud of that, but we've still got a bit of a gap there, so let's really continue to make sure that we are reaching you, because I know I've had some messages myself of people that are still a little bit unsure. We live in a very multicultural community, so if you're having challenges and you're not being able to get that information, please reach out. There's lots of networks that will support you. The Ethnic Council, Greater Shepparton City Council, contact me, whatever it takes, that we can actually support our community. It has been, as we say, a very difficult time, but we know that vaccinations are the roadmap out. This morning I was out and about across Greater Shepparton and our businesses are just loving being back to work. We want to keep that happening, so please, you know that you make that difference if you get vaccinated. We want to keep our businesses opened. We want to continue to learn to live with this virus, and we know that that's vaccinations. But I'm very proud of our community. We're almost there. The numbers are great, but we're not quite there yet. So please, if you know someone that is having difficulty, as I said, getting vaccinated, help them along if that's what it takes. Also, some people are still in isolation. If they're having difficulty getting support that they need, please reach out. There's plenty of networks, as we said, council, there's lots of organisations that are there to support and help our community. We're an amazing community. I'm extremely proud of what we have achieved so far. We've been here, we've done it before, we'll do it again as far as supporting each other, but we've just got a little way to go. So let's continue to do what we need to do. Vaccinations is the key and we will get there. So take care everyone, and as I said, reach out if you need support.